Sinus infection and bronchitis are both common conditions that can cause significant discomfort and impact daily activities, but they affect different parts of the respiratory system. With a sinus infection, also known as sinusitis, you may experience pain or pressure in your face, nasal congestion, and possibly a greenish or yellow nasal discharge, signaling an infection within your sinus cavities. In contrast, bronchitis primarily inflames the bronchial tubes in the lungs and can lead to symptoms like a persistent cough that produces mucus, shortness of breath, and chest discomfort. Treatment for these conditions varies. Sinus infections may resolve on their own or with the help of antibiotics if bacterial, while bronchitis treatments focus on symptom relief and may include cough suppressants, bronchodilators, and in some cases, antibiotics. Risk factors for both conditions include allergies, exposure to irritants like smoke or pollutants, and a recent cold or flu that can predispose one to developing these infections. Here are detailed aspects of sinus infection versus bronchitis to further illuminate their distinctions and management. Location of infection: sinuses versus bronchial tubes. Sinus infections, sinusitis, and bronchitis both cause discomfort and symptoms like cough and fatigue, but they differ in the infection's primary site. Sinusitis affects the air-filled cavities around the nasal passages, resulting in symptoms like facial pain, pressure, nasal congestion, and purulent nasal discharge. Sinus infections can be viral or bacterial and often follow a cold or allergic reaction. On the other hand, bronchitis targets the bronchial tubes, which carry air to and from the lungs. This leads to inflammation of the bronchi, manifesting in a persistent cough that produces mucus, wheezing, and shortness of breath. Chronic bronchitis, usually due to smoking, differs from acute bronchitis, typically caused by infections or environmental factors. Understanding these distinctions guides appropriate treatment, such as decongestants and nasal irrigation for sinusitis versus cough suppressants and bronchodilators for bronchitis. Primary symptoms: nasal congestion and pressure versus persistent cough. When discerning between sinus infection, sinusitis, and bronchitis, a keen observation of symptoms is crucial. Sinusitis typically presents with a cocktail of facial discomforts, nasal congestion, pressure around the sinuses, and often a headache that thrives around the forehead. Think of your face as a battleground where pressure and mucus buildup reign supreme. On the other hand, bronchitis turns the spotlight onto the chest with a persistent hacking cough, often bringing up mucus from deep within. Whereas sinusitis feels like an upper facial siege, bronchitis feels like a relentless tickle or irritation lurking in the airways, often escalating when lying down. Both conditions may overlap with symptoms like fatigue and minor breathing troubles, but it's the location and persistence of symptoms that whisper the secrets of their true identities. Nature of cough: mucus production, thick nasal versus chest mucus. Sinus infections or sinusitis produce thick mucus that drains from the nasal cavities, often leading to postnasal drip, which can cause a cough. This nasal mucus is typically green or yellow, reflecting the presence of white blood cells fighting infection. Conversely, bronchitis affects the lower respiratory system and results in mucus production further down in the chest. The cough in bronchitis is deeper, and the mucus expelled can come in various shades from clear to yellow or green. Notably, the mucus from bronchitis is typically more voluminous and can be accompanied by a wheezing or a rattling sound due to airway inflammation. Understanding these nuances helps clinicians pinpoint the source of an infection for targeted treatment. Common causes: bacteria or viruses in sinuses versus inflammation in bronchi. Sinus infections, sinusitis, and bronchitis often share overlapping symptoms like cough and nasal congestion, but their roots diverge within the respiratory tract. Bacteria or viruses nestled in the sinuses trigger sinusitis, leading to swollen, inflamed nasal passages and sinuses filled with mucus. Conversely, bronchitis zeroes in on the bronchi, the airway branches leading to the lungs. Here, the inflammation typically stems from viral infections, though bacteria can also be culprits. Distinguishing between them hinges on symptoms' duration and location. Sinusitis brings facial pain and postnasal drip, while bronchitis is characterized by a persistent cough that may produce mucus and is frequently accompanied by chest discomfort. Typical onset, post-cold or allergy versus after upper respiratory infection. Sinus infections, often following a cold or allergy, manifest with a buildup of pressure in the facial cavities, leading to headaches, nasal congestion, and facial pain. The sinuses, air-filled spaces behind the forehead, nose, and cheeks, become inflamed and can create a bacterial secondary infection, prolonging symptoms even after the initial cold or allergy resolves. On the other hand, bronchitis typically develops after an upper respiratory infection. It infiltrates the bronchial tubes, inducing persistent cough, production of mucus, and sometimes shortness of breath. Bronchitis can be acute, lasting a few weeks, or chronic, indicating ongoing inflammation or damage to the bronchial tubes, often exacerbated by smoking or pollutants. Distinguishing between these conditions is crucial for appropriate treatment, such as antibiotics for bacterial sinus infections and supportive care for bronchitis.